Hey everybody. Number one is the low back, hip pain, and those. This is something that I struggle with too. I've had low back pain on and off since high school, I think, so half of my life probably. I didn't really understand the cause and the drive behind it until I got older, when I realized I have a lot of hypermobility in my body, and so strengthening is hugely important for me. If I don't strengthen, oh my gosh, my husband. If I don't strengthen, my symptoms come back. My prolapse symptoms come back. My low back pain comes back. My abdominal pain, hip pain, all that comes back. That's for me. I know a lot of you, the majority of you, are hypermobile, right? Prolapse in young people often comes hand in hand with hypermobility. So if you're experiencing a lot of these things, you might consider progressing with your strengthening. And if you're not sure how to do that, let me know. I'm happy to help guide you. Pop Principles covers a lot of that. Low back and hip pain, glute pain can also be nerve related, so you need to make sure that your physical therapist is ruling that in or out if that might be a cause. It can be a joint dysfunction, so our facet joints in our spine, our SI joint can refer pain to different areas and can be drivers. The discs in our spine, so between the vertebrae, they actually have nerve endings. They're not just these things that exist without any innervation. So if there's been any sort of irritation to that tissue, who knows why, that can be a driver of pain as well. There are numerous things that can cause hip and low back pain. Even GI stuff, some GI things can refer. Gosh, I mean, the list goes on and on and on. But the moral of the story is, if you're dealing with some chronic type low back, hip pain, discomfort, get it treated. There are options. It might mean some work on your part, but get it treated. Okay, moving on to the tailbone pain. Coccyxdynia is the diagnosis of what that is. So the coccyx, the tailbone, has a ton of pelvic floor muscles that attach to it. I don't have my really awesome model or print with all the pelvic floor muscles written out, but I can show you in the clinic if you guys want, or I can just share a reel where I've already used that image. But I do have just a general printout. It's not exactly the anatomy, but at least I can kind of show you what's going on. All right, so here's the pelvis. You're looking down into it. This is your sacrum. Okay, these are your innominate bones. Here's your pubic bones. This would be the opening to the vagina. Your urethra would be here. It's not there. Like I said, I don't really like this image that much. And here's the opening to the rectum. Here's your tailbone. Okay. And as you can see, all right, so here we go. Tailbone, all these pelvic floor muscles attached to it, right? So puborectalis would wrap around, pubococcygeus attaches to that. We have iliococcygeus. These all attach onto the tailbone, right? So if there's tension in these surrounding tissues, they pull, and that can cause tailbone pain, okay? There's also a muscle called the obturator internus. It has a referral pattern down the back of the thigh or directly to the tailbone, so that can be a driver of tailbone pain as well. Someone asked if you can do releases rectally with a wand, and the answer is yes, but I would definitely get assessed by a physio before you do that and just get some instruction on how to do it, because the rectal tissues are very fragile. And you want to just make sure that you're hitting the right areas, but I will show you right now how to do that. This is my intimate rose wand. This is the end that you would use vaginally, and you can actually use the opposite end rectally. It's more narrow, so it's even smaller than my finger, and I have really small hands. So this would be how you can use it rectally to get to coccygeus. There's a lot going on over here, guys. You can also use the wand vaginally to get to these tissues. You just have to kind of turn it and go back like this. So the end would be coming straight up between your legs, and you'd be reaching back towards those tissues. Again, I would definitely ask your PT or physio to give you some guidance on how to do this for yourself. You can actually also get to the obturator internus with the wand vaginally as well, or rectally, but it's a lot easier vaginally. So yes, you can use this, but I I recommend getting assessed and getting some guidance on how to do that. Now let's get really sciencey about the strengthening stuff. So the question was, I've been doing 5 weeks of pelvic floor therapy. My strength has not improved from a 1 out of 5. So a 1 out of 5 is a flicker of a contraction. That's it. No actual true closing or lifting, nothing like that. That's a 1. What we know about muscle strength is this. The initial improvements in muscle strength when you start a strengthening program are neuromuscular changes. So our nerves come from our brain, spinal cord, out, and then they split and innervate these different motor units in our muscles. So the more connections we have from the nerve to the muscle, the more quickly the muscle will activate. The contraction will also be stronger, and you will get more muscle cells firing and contracting. That's the initial gains when you start a strength training program. We also know that to improve 1 grade in a strength, the strength scale that we use in physical therapy, which is an MMT, manual muscle testing, which goes from 0 to 5. It can take 6 to 8 weeks to improve in 1 grade of consistent strengthening, not just occasionally doing some strengthening here and there. If it was your bicep or something, you'd have to be doing regular bicep curls and bicep strengthening activities to improve your grade. So that's 6 to 8 weeks for that. Then we also know that hypertrophy is an increase in the size of the muscle cells. You don't actually get more muscle cells. It's kind of like our neurons